is to realize that some of this is totally out of my control. It's in a greater power. You know, it just, you can't understand. Every second that you're without oxygen just makes a huge difference. And if they hadn't called the helicopter, if they had just tried to drive him downtown, or if we spent any more time on the scene, or if we didn't unload him with the mom with the aircraft running, all of that, all those things took into play as far as his outcome.
So one of the hardest cases I've had hands down in both my career as a physician as well as a flight physician was, and I remember this as if it was yesterday. I mean, it was September 17th. I was a second-year resident. It was 12:20 in the afternoon. I was working a normal shift in the emergency department, and the tones went off for a flight. And it was a beautiful day out. It was nice and sunny and a nice temperature. And I remember thinking, that's not my flight, it's the other doc's flight, because the shift started at noon. And then I got toned out to go because of a snafu with that other physician not having his equipment and having to run home and get it. And so I go out for that flight, and we find out who we're going to get. And it was one of the former medical directors of Air Care, one of the founding fathers of our program, both as an attending physician and the person who signed my ACLS card is the person who first taught me ACLS and first credentialed me to do that, as every intern gets when they come into the hospital. And I remember us having a good time flying out there and thinking that if this person was to call for a helicopter, he can do what he wants because he founded the program. And if he wants a helicopter, he gets a helicopter. Not really having any idea why we were going to get him. Didn't really know much about his medical history or his problems. And then we get a report from the ground from a paramedic who was just visiting him. There was a gentleman from Blue Ash, I believe, who was just visiting him and hanging out with him. And our patient became, I guess, just very sick right there in front of him. And the report that we got was chilling. And it was all of a sudden the mood and the tenor in the helicopter changed as we were flying out, because we had about a half-hour flight to get out there. And we were very acutely aware that he was very, very sick. And all of a sudden, myself and the flight nurse, who's no longer with the program, just locked in. I mean, it became just a very much, we knew the significance and implication of what we were going to do. And we get in, we land, we get in the back of the ambulance, and I walk into the back of the ambulance, and there's a elderly gentleman, who's really not that old, sitting there breathing about 30 or 40 times a minute, as blue as a pair of University Hospital scrubs. And all he kept saying was, intubate me, I can't breathe, hurry up, please intubate me. I didn't know him personally really much outside of that, except for as the man who signed my card and who was about as important as any other single physician in our department, and certainly meant a lot to the pre-hospital community in the city of Cincinnati and northern Kentucky. And so the nurse established the IV of her career because it was very difficult, and I intubated him, and that was the intubation of my career. It was one of the hardest ones I've ever done physically, technically, and emotionally. And the minute I intubated him, he went into cardiac arrest. And so at that point, emotion and adrenaline kicks over and takes over, and you just start doing what you're trained to do. And I did everything that man trained me to do and ran the code of all codes, and we coded him all the way back to University Hospital. He got shocked multiple times. He was given every drug that we had available in the drug box, whether it was, with what he needed. And the most chilling thing about that whole case that I'll never forget is that if you know anything about medicine, you know anything about EMS, he went in and out of every malignant rhythm that you could possibly have, except for when we landed, he went into asystole. And so technically, he died in the helicopter that he helped found and start for our program before we landed on the helipad. The code continued down into the emergency department, and the next most important thing that I remember was coming around the corner into our trauma bay and seeing 10 or 12 of our faculty waiting for us, because they knew who it was, they knew that he was coming, and the physician whose flight it was supposed to be was up there and took over CPR for me, and we coded him all the way downstairs and coded him in the emergency department, where he was eventually pronounced dead. And the implications of that, it's the only shift that I've been sent home from clinically. I felt fine, but was told, you're done, go home, take the rest of the day off. And I remember driving out, I live out in Mason, Ohio, and I remember driving to a park and not really knowing getting what I just did, what just happened. I didn't yet understand the significance of it. And I didn't want to talk to my wife, and I didn't want to talk to anybody from the program. And one of my best friends, who's a pediatrician at Children's, found me and found me in the park. And we just sat there and just talked for about a couple hours, came home, and had to get back on the horse the next day. They tried to get me to take a day or two off work, and that's not what I do. That's not what we do. And I was back at work at 7 o'clock the next morning. The funeral was one of the most awesome, spectacular funerals I've ever been to. The entire air care crew went. He got a flyover from the helicopter. There was a helicopter parked at the gravesite. He had a horse-drawn carriage with the entire flight crew in uniform walking behind it. I still have an email from one of my mentors and close friends, and this is so true to anybody who works in medicine, because not everybody lives and not everybody survives that you do this work for, but sometimes that's okay. And it merely read, Bill, I reviewed everything that you did that day. I read everything that you did, and you did everything right, and everything was done correctly. Sometimes and often, the ghosts of those you take care of will walk with you forever. Well, it's true, and it's a story that I don't tell as often anymore, and I really didn't tell it much earlier just because most people knew it. And it's interesting now that there's an entire generation of residents and even faculty in our program that never knew him. And he's a godfather of our program. He is one of the founding fathers of emergency medicine, the entire specialty of emergency medicine, much less the Department of Emergency Medicine at Cincinnati, University Air Care. It's bigger than that. And there's an entire legion of people that don't know him and won't know him. And he lives through the memories of all of us and how he trained us and how he trained us to do what we do. And it's too bad that a lot of these people, it's like losing a grandfather that your kids didn't get to meet. It's the same kind of thing with our residents these days, is that the spirit that he has, that he's left through all of us, still lives on in how we teach and how we train and how we fly and how we interact with pre-hospital care, how we work with paramedics out on the scene. All boils back to Dan Storr, even though he died several years ago. I'm still the only one that has coded an attending physician in our department, and it has shaped who I am, but it has also gone through the 12-year-olds that I've coded and the 8-year-olds on air care and people who weren't supposed to die, and 20-year-olds, and even up to the 80-year-olds who might have lived a nice full life, and that's an acceptable endpoint, and that all of that kind of helped shape me from this one particular case, because from the time I intubated him to the time he was pronounced dead, I didn't think who it was. I was doing what I was trained to do, and I did it well, and I did it with the nurse that I was with, who, by the way, was the first nurse hired into this program by the patient. And she had been with the program the longest. And in terms of the numbering of the nurses, she was number one, and then there are others that are still here that rank number 2 and number 3 even. And it was, I'm not sure why it was me that did it that day. I'm not sure why the nurse was there or the particular pilot that day. In fact, I'm the only person left on air care from that crew that is still with the program, just by people moving on and retiring and doing what they do. But I will forever be indelibly linked to that crew and that patient, and I'm both honored and proud to have done it. And I like to think in some way, shape, or form, even though he didn't live, that I did exactly what he told and trained me to do.